Welcome to the Cheer Athlete. In this week's episode, we're going to talk about overuse injuries in cheerleading and why they happen and how to prevent them. Welcome to the Cheer Athlete podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. You all have seen a stunt come down, whether at practice, a game, or a competition. And it's scary. And especially when the cheerleader doesn't get up from the injury and you know that there's an actual injury. But the truth is, most injuries in cheer don't happen from those traumatic falls. They're big, but that's not necessarily always the reason that an athlete ends up out of practice and injured. These overuse injuries will happen slowly and over time, and they kind of build gradually. So today I'm going to explain why overuse injuries happen in cheer and give you 3 things that you can start paying attention to right away. So let's first start with what exactly is an overuse injury and what happens. An overuse injury happens when the body doesn't have enough time to recover. We are always on the go. There's not enough time to actually slow down and let the tissues heal. The stress ends up stacking up gradually over time, and it happens faster than actually recovery allows it to get better. And so gradually, like little micro tears and strains that just continue to happen. And then that creates pain and it creates recurrent injury and it creates general trauma, which adds up over time. Some common overuse injuries in cheerleading are repeated ankle sprains, maybe a knee pain, a patella tendonitis, or patellofemoral syndrome, IT band syndrome. We are just overworking and you're feeling anterior knee pain or pain on the side of your leg. You might get shin pain. We call them shin splints, that just doesn't go away. A big common lower back injury would be a spondylolisthesis or spondylosis, in which there is repeated strain in through the back that creates low back pain with extension moments, such as with tumbling and with jumping, and that repeated injury and that hyperextension gradually over time. If we're not strong enough and we don't have the recovery time, it creates that injury into the lower back. You might have a lot of wrist pain. When your cheerleaders are complaining of wrist pain, that tends to be an overuse, that they're not taking the time to recover, not having enough mobility into them. You might notice this a lot with bases and tumblers. And then shoulder irritations and, recurrent that it's tendinitises, which develop into tendinosis, which is a longer kind of a chronic irritation and inflammation. Pain in this instance does not mean that something is broken, but it does mean that something needs attention. So why are cheerleading injuries really set up to be perfect for overuse injuries? Well, we have a lot of repetitive motions in our practice, correct? Right? We have a lot of repetitive jumping, or you go back to practice after competition and you just throw your tumbling over and over and over again. That sets you up for repetition and repetitive strain. We do a lot of long practices. It's 2-3 hours. If we're really prepping for a competition, we may have longer. That repetitiveness and trying to cram as much as we can into a practice makes the body be tired. We have limited off season. This, I preach this all the time. In this limited off season, you're allowing your body to rest and recover. You're not taking a break and doing different motions than we do every day in cheer. When we finish the season in May and we start in June, it doesn't allow the body to rest and recover. Let me talk about competitions, and it's a weekend event. There's 2 days. They are on the go with like having to hit and maybe lack of sleep. Maybe they're not eating as well as they normally are. They're not hydrating as well. And that causes that repetitive strain again. So cheerleading isn't just intense in the moment, but it's repetitive and we're doing the same things over and over again. So when we have these constant activities that are just keeping our body in the same strain, it doesn't allow the joints and the tendons and the muscles to recover. So let's talk about some takeaways. Number 1, pay attention to patterns, not just pain. Is the pain always showing up in the same spot? Are they complaining of their shoulder? Is it like Is it kind of just in here, and it's every day they come home and they're like, oh, my shoulder hurts, or their knee? Is it constant over time? And is it getting worse over time? Is the soreness lasting longer than a week? If they have a day off, their body should recover. If they're practicing Monday, Wednesday, Friday, on Tuesday, they should be doing some gentle mobility work. Maybe that's when they're working on their strength and their flexibility, but not doing the same motions. But if that's not going away and that soreness continues to last, and then maybe it comes down a little bit, but then they go and aggravate it again the next practice, and then they aggravate it again, then that soreness just continues to build. Changes in movement and confidence and how they're moving. So if they're having pain, are they starting to limp? Are they starting to favor their arm? If their shoulder's hurting, are they avoiding reaching, or are they changing how they're moving so that it doesn't hurt? Watching these patterns, and looking at what's happening in their body is more important than just one bad day, something that's happening over time. Number two, recovery is part of training. We talked about this last week, so go back and listen to that episode if you haven't already. Recovery doesn't mean that you're not doing anything. It doesn't mean doing nothing and just kind of hanging out, but it does mean that you are doing some recovery work. Maybe you're doing some foam rolling. Maybe you're doing some ice. Maybe you're doing some gentle mobility. Maybe you're finding positions of comfort to allow the tissue to quiet down. It doesn't mean that recovery doesn't mean that you're stretching harder. It doesn't mean that you have to, oh, my knee hurts, I've got to stretch and stretch and stretch more. It may mean that you have to stretch less, and it may mean that you have to go easy and gentle. Recovery means that you're allowing the body to kind of rest and recover and reset. So finding that gentle movement, doing some breath work, getting enough sleep, going to bed early, and trying to spread out the hard days. Coaches, if you're listening to this, try to spread out. I don't like doing just a tumbling practice where they are just throwing the same thing over and over again. I think that just sets you up for further injury. But if you can spread that out, maybe you have to do more repetitions on tumbling because that's where you got marked down on and you want to do a little bit better. Maybe do some tumbling in the beginning and then go into dance or something that's completely different, that's not giving them the same strain. Maybe they do conditioning at the end. Just limit the amount of repetitions. It's like a baseball player. Youth baseball players are limited. They are limited with the total number of pitches that they're allowed to do. And that's because that repetitive use actually sets them up for more of an injury. So spread out the time, limit the amount of repetitions that they're doing in one setting, and really allow the body to rest and recover. If recovery doesn't help, so if you get home from a hard practice and things are feeling a bit sore, muscle soreness is okay. That's, you go to the gym, you work out, you come out and it's a new workout and you're like, oh, so a couple of days you're like, you're a little stiff and sore, but that's like, okay, I did some work and it gets a little bit better every day. If it's lasting for longer than 3 days and you have to take time off after, it was too much, and your recovery work, maybe some of that stretching or the rest didn't do its job. So we need to pay attention a little bit more to that. Tip number 3, don't guess, use simple decision tools. And this is where my injury prevention starter kit can help you, paying attention to patterns, keeping track of it. Most of the time parents will guess, or they'll go on social media and ask, is this a problem? But when we guess and we just are kind of chucking it all up in the air, like, should I get it checked out? Should I not? Is this an injury? Is it not? It may lead to the athlete pushing more when maybe they need to actually sit out for a little bit or not do that one skill for a little bit. I know a cheerleader that I'm encouraging her to limit her number of repetitions on her landings, whether it's jumps or tumbling, and because it was aggravating her pain. And I didn't tell her to sit out. I just, throw it till it starts to hurt and then stop. Do some recovery work, do some mobility that helps you to feel better. Taking that time to rest and reset will allow her so that she can make it through the season and can compete. But if she kept pushing through and keeps going, it's just going to get more sore. And then she potentially may be out and have to miss an entire season. Sometimes also it's the flip side. Sometimes you're like, oh, things are really bad. Let's just stop everything and not do any mobility or any stretching or any recovery work, and just rest and stop doing everything. But that in itself also can aggravate and create more problems. Like it is important to do some rest and recovery, but it doesn't mean that we just stop altogether. The things that help with an overuse is gentle movement, finding out what's missing, getting things stronger where they need to be. A lot of times with shoulder, we're missing a lot of external rotation, and everything is, our shoulders are all forward and everything's more internal. So doing things to strengthen the motions back this way may be what it takes to help that overuse injury. We're really tight through our IT band. So maybe you roll, but then you're also strengthening, why is that IT band tight? What's the muscles that are attached to the IT band compensating for? And that might be it might be your quads. Your IT band is a combination of, your glute max attaches and your glute med and your TFL all attach in there. And so, if we just are figuring that that's tight because it hurts, but we're stretching that, it might not actually be what needs to happen. We might actually need to get glutes a little bit stronger. So stretching our quads and strengthening in our glutes may actually help stabilize and decrease that IT band. And figuring that out and kind of knowing if the stretching and the activity isn't helping, let's pivot faster than not. Being clear on what's going on, and is it actually an overuse injury, or is it something that we have to pay attention to? Being clear on that helps to prevent those overuse injuries, and more than fear ever will. So knowing what's going on, definitely, once you know, hey, this is more of an overuse injury, let's address it and take steps to make it better. This is exactly why I created the Injury Prevention Starter Kit for cheer parents who want to understand what they're seeing and to respond calmly and take the appropriate steps to help their cheerleaders feel better. There's a pain and soreness flow sheet to help you determine whether or not it's an actual injury you need to go get checked out. There are recovery routines. There's red flags that you need to pay attention to. There is a tracker for practice load and being aware of what they're doing on a regular basis. And it's all designed to help reduce that guessing and make it more clear to know whether or not you need to get in and go see somebody. If you want these simple tools to help you prevent overuse injuries and to support smarter cheer training, you can find this Prevention Starter Kit linked in the show notes. It's affordable. It's only $5. It's easy to use. There's tons of information, and it's meant to help work alongside cheer, not to replace what you're doing in cheer already. And it's meant to help keep the athletes on the mat so that they're not having to miss a lot of time. If you just take away the 3 tips from today, that alone can make the difference. So no pressure to buy it, but go back, revisit this, listen to it again, pay attention to the patterns, have a clear plan, and make sure that you include recovery and warm-ups into part of the training, so it's not, these are not optional, and it allows the rest and recovery to happen and decreases the risk of overuse. Remember, like I talked about in the beginning, most cheer injuries don't happen from one bad moment. They can, and those are usually more catastrophic. We can talk about them the next time. They may come from small signals that were ignored for too long. We have that nagging knee pain, we have that nagging shoulder pain. It's okay. It doesn't really stop us from doing anything, but gradually over time, it's not getting better. These are things that we need to pay attention, and we need to take some time and figure out. And, get in and see your physical therapist. Just because you go to physical therapy doesn't mean that you have to sit out from cheer. They may be able to give you some good tips to help you keep going and stay on the mat and be able to manage it so that's not doing the same strain over and over again. All right, I have an Ask a PT form now. So if you have questions and there's something you want me to talk about injury-wise on the podcast, go ahead and fill that out. You don't have to leave your email address, or if you don't want to be on the email list, it's okay, but it allows you to have some way to ask questions and get more specific answers for your specific injury. I look forward to helping you figure out, stop guessing, be clear, know when you need to get your athlete seen and keep them healthy so that they can stay cheering, or if they have to sit out, that they get back sooner than later. Thanks for listening to this week's episode. I look forward to seeing you next week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. Let's go get the day.